Okay, so I'm presenting on Twiddler syndrome. So it's a rare but potentially fatal complication with pacemakers or ICD placement. It typically manifests within the first year of the device placement, and there's it's not very well known, so there's not a lot of clinical suspicion for it. So this case, we had a 34-year-old female that had hypertrophic cardiomyopathy and proximal AFib. So she had a pacemaker ICD placed for primary prevention of sudden cardiac death. And then her risk factors for Twiddler syndrome for this were female sex. She had an increased BMI and she had some psychiatric comorbidities. These had been noted as risk factors in the past. But basically, I'll get right into the case. She's a 34-year-old female, and this first X-ray is her post-op implantation of the pacemaker. So you can see if it hopefully it's not too small, but my right arrow, my red arrow here is
Hmm.
pointing to the right atrial lead. And then you can see the thicker lead is the ICD in the right ventricle, and that's indicated by the blue arrow. So this is a normal post-op X-ray. About 4 months later, she presented to her primary care physician and she was having muscle spasms that actually started over on the right side of her chest and were moving over to the left side of her chest for around 5 days. Her PCP sent her to the emergency department at that time to rule out any cardiac problems. And a chest x-ray was done, and it was read as normal, no acute abnormalities at that time. And she was discharged home and sent to follow up again with her PCP. So on this chest x-ray, you can see that her ICD is in place in the right ventricle, um, and that right atrial lead is retracted all the way back to that red arrow, right underneath the ECG clip. That's obviously exterior, but you can just see the tip of that lead has actually been all the way retracted back almost to the generator at this point. So 6 months later after that, she returned to the emergency department after she had a shock delivered at work. Her device was interrogated and it was deemed to be an appropriate shock for VTAC plus or minus AFib at a rate of 194. A chest x-ray was done again at this time and it was read as normal. And cardiology was going to go see her, but she ended up leaving AMA from the hospital at that time. And then shortly after that, well, look at that X-ray too, and you can see now the atrial lead is actually all the way back into the generator pocket. And that chest X-ray was read as normal. 2 weeks later, the patient presented yet again to the ED after an ICD shock. It was interrogated, deemed to be an appropriate shock again. She had a chest X-ray. This time she got two views, and it was interpreted as no acute abnormalities. At this time, she stayed in the hospital and cardiology came to see her. Um, and I was on my cardiology rotation. We took a look at her serial x-rays, and you can see on the two view that her atrial lead is all the way back in the generator pocket. And thankfully, her defibrillator lead is still in the right ventricle, appropriately placed, but her atrial lead has been pulled all the way back into the generator pocket. Um, so, on conclusion of this case, due to the patient's uh, kind of socioeconomic risk factors and a lot of discussion with her, revision of her pacemaker was not recommended. And we talked to her about manipulation, and she completely denied like ever touching it. So in the literature, it's described as either conscious or subconscious manipulation of a pacemaker. So some patients can manipulate their pacemaker um, and have no intention of it or not realize they're doing it at all. Um, this was first described by Bayliss in 1968. Um, and most cases occur within the first year. And then this case also aligns with the known risk factors, female sex, increased BMI, and then she had a few psychiatric comorbidities as well. So I think kind of the big picture for this case is there was repeated imaging without attention to the lead positioning. or clinical suspicion that this could be going on. And I think it highlights the need for clinical suspicion of Twiddler syndrome, and then really paying attention to your lead placement on chest X-rays when you get them.
Very nice presentation. Are there questions?
I have one in the chat. What's the long-term prognosis for someone with Twiddler syndrome?
So in her case, the long-term prognosis is still good because she has the defibrillator lead still in the right ventricle, and her pacemaker was placed for primary prevention. So she is still able to get shocked if she goes into an arrhythmia. The atrial lead was placed more due to the AFib. So ultimately, it was decided that she didn't necessarily need a revision, and her prognosis will be fine, and that ICD lead will function normally. And it was likely not pulled back because, as you can see, it has coils on it, and it's a bigger, thicker, heavier lead. So she would have, even messing with the pacemaker, it's harder to pull that lead back out.
I have a question.
Yes, sir.
This has been around since '66, but I wonder whether you ought to separate the literature from previous literature and what's occurred in the last 10 years. Because I think part of this whole thing of people being isolated, COVID, mental illness, anxiety is now going up very much. And I suspect this is going to become a more common thing. And I think looking at the literature, what you're saying, you can see whether in fact that's true. See, like you're saying, I suspect it's going to be all right. We don't know that. And I think you could do a very important thing by segregating out the literature.
Yes, sir. That would be very interesting to look into. And I'd agree. Anxiety and everything is skyrocketing, and I think it will become more prevalent.
Thank you very much.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.